CDC says fewer patients have been admitted to hospitals nationwide compared to previous waves, but hospitalizations are still climbing in parts of the country with lower vaccination rates. Free COVID-19 tests from the federal government have begun arriving by mail, and N95 masks from the national stockpile are being handed out at pharmacies and community health centers across the country. We've seen them at the grocery store, the gas stations, and our favorite mom and pop stores, but nowhere has been hit with the COVID-era worker shortages more than hospitals. 7 News reporter Colin Roos takes us to 2 Northern Panhandle ERs whose new workers are wearing camo instead of scrubs.
Just when we think we're starting to see some trending downward, we get hit, with the emergency room at night.
Winter is never easy on those who work with the sick. But recent memory has never seen such a low ratio of hospital staff to those who desperately need their care. That's why the state has called in those who pledge to be always ready and always there to supplement the healthcare workers who do the same.
We've got a lot of staff members that get this Omicron that have to be out for 5 to 10 days quarantined. It takes a toll on staffing.
The National Guard will be seen in their combat boots all over Wheeling Hospital and Reynolds Memorial, helping with crucial day-to-day jobs that aren't often thought about when it comes to healthcare. Tasks like clean sheets, moving patients between rooms, and disinfecting surfaces. They'll only be here through mid-March, but they'll fill in some important non-medical gaps as a months-long bed shortage continues. More than 250 Guard soldiers and airmen are pitching in statewide after Governor Justice called on their help earlier this month. Now they'll be supported by another 100 Guardsmen who will begin training next week. And just in time, with concerns of yet another variant among health officials, the morale is critical as we're all plunged into coronavirus year 3.
I really hope they'll bring some enthusiasm and to our team, that our team sees the commitment from the state and from these fine servicemen and women helping out.
But despite the uncertainty of where we'll be a week from now or even tomorrow, our service members can be counted on to do what they've done for centuries, offer protection and a guiding light when a weary public can't see the path forward. Reporting from Glendale, I'm Colin Roos, working for you.
The number of Guard members varies between hospitals, ranging from 2 in smaller places to more than 24 in Charleston and Morgantown.